Oh, no. One more call.
Calling from an 865 area code. Calling from an 865 area code. Who's this? Where are you calling from?
Is that me?
Yes, it is you. Who's this? Where are you calling from?
Oh, thank God. Okay. Hi, I'm Amy from Nashville. I've been trying to call in for a while about the various transphobic bills that have been going through the legislature for a while.
Amy from Nashville. Do tell.
Yeah. So basically, just as a brief overview, I actually wrote up a fair bit. I just some notes anyway. But there's 6 bills that I've looked into. 3 are working their way through the legislature right now. One is basically bans helping children transition or helping them in any way identify as the opposite gender. This one seems more broadly tailored than the doctor bills. It seems like it might hit parents too. Then there's one that seems to be making an explicit definition of sex in the law. Seems designed to prevent changing your driver's license. In our state, currently you can change your driver's license, but not your birth certificate. For a while, we were actually, I think, the only place where you couldn't change your birth certificate. That has, of course, changed. Lots of places have joined us. And then, most importantly, and this one has possible national implications, and it's one that you guys should be looking out for. So basically, Tennessee contracts out Medicaid. What the bill basically says that you cannot be bidding for the Medicaid contract if you provide gender affirming care anywhere in the country.
Wow.
Now, our particular healthcare economy is not going to make that big of a dent. But if other states join us, this could be an issue. Like Florida and Texas combined have enough of an economy that maybe that would start making them,
just to be clear on this, we see this, when Texas decides they're going to change their textbooks, we end up getting them changed across the country because there's so many school children in Texas that it doesn't make financial sense for if California changes its emission standards. Usually you start to see car makers just follow through because they sell so many cars in California. It almost is less, it's too expensive to maintain different standards outside of California. Yeah. And so you're suggesting that Tennessee may be modeling this Medicaid contracting provision, and if it's adopted by a Texas or a Florida, that's really problematic because those are big states for Medicaid.
Yes, and I don't know the degree to which my assumption is that the ACA didn't have anything in the patient protection program that said that healthcare or health insurance must include gender affirming care. So I'm guessing that this is like a viable strategy in the long or medium term. Obviously, the Tennessee bill not going to do it. Right. Oh, okay. Specifically, it's Senate Bill 1339 and House Bill 1215. Somebody named James Finn wrote a good article on it that I read. It was on Medium, I think. And then those are 3 that are currently moving through our legislature. There were 2 that were just passed on the 2nd. One is fairly well reported. It's apparently their top priority. It was Senate Bill and House Bill 1. That was specifically about preventing medical care for minors. If it is, quote, for the purpose of enabling a minor to identify with or live as a purported identity inconsistent with the minor's sex. Then there's the second one is what's been referred to as the anti-drag bill. I do want to tailor that a bit. But this was, I was the one who IM'd in a week and a half or so ago saying that on the day that these 2 bills were signed, somebody hung a Nazi flag over the interstate in the inner beltway. I guess it wasn't really the inner beltway. Anyway, the interstate goes straight through downtown, and it had a variant of the 14 words, and weird that they didn't actually get it correct, but whatever. And then also like specifically said, thanked Bill Lee for sticking it to. I'm not sure whether or not I can say the specific words, but it was Lee, the F-slur and the T-slur. I would just say it, but I don't know your standards. So anyway, the drag bill, I do want to tailor people's understanding of it a little bit, because it uses a lot of very vague terminology that seems designed to make it easy to interpret differently on the local level, depending on, whether like a local judge is particularly hostile to us, or whether or not a particular cop wants to get a little ballsy. And it specifically, for example, uses the term, quote, male and female impersonators. And there was, I think, another state legislature that was also using this term. This is like a term that 125 years ago or so would have been the correct term to describe drag performers.
Right.
But now it is a term that seems specifically designed to obscure the truth while having this sort of like old-fashioned excuse to be using it. And it seems to me like this law, seems like it could make it impossible for just like a trans person, whether they are, because right now, I've had some stumbling blocks in my medical care. So like phenotypically, I'm not quite like obviously male or female in a number of ways. And so no matter what I try and pass as, like there's aspects of my physical body that would suggest that I'm passing for something. So like it's unclear how somebody who's in my situation, even if I were to go back in the closet, would necessarily be able to do all sorts of things that are, in public, like giving a public speech, or I don't know, going to do karaoke,
right,
or doing stand-up at an open mic. I will say that the bill was like also edited last minute to go into effect April 1st instead of July 1st, which is when laws usually go into effect here. It seems specifically so that like we don't get Pride in June. I mean, I could go on and on about like the different like vagaries in this bill. I've read it a lot, and
vagaries both in terms of like things that are offensive, but also things that are like purposefully vague, so as to. I mean,
yeah.
This has been a tactic that they're deploying that I feel like they learned from Florida on some level that is across the country, which is if we make it sufficiently vague enough, and we can force, and if we create enough of like a mechanism for punishment, then we can force we don't have to do as much work, and we don't have to actually like define what's going on. We can just sort of create this environment where there's like self-censorship. Censorship's not exactly the right word, but like a self-policing mechanism, because people don't know the lines that they could cross, and they just know that there's something that's going to essentially electrocute them. And so, we're going to hide where the third rail is. And so you just don't, you don't go near the tracks at all.
Like I at this point, like, cause karaoke and like stand up were things that I did every now and then, at least before COVID. And at this point, like, I'm probably not doing it until I'm able to move out of the state.
Right.
Like after the end of this month. Let me just give like one example.
All right. And then we got to go because we got to wrap up. But I appreciate this.
Instead, let me give the sixth bill because it's good news.
Okay.
It's kind of a pick me up. So this one was, it was introduced in February of 2021. It was signed by Bill Lee in that May. And like most bills, it was going to go into effect in July. It was basically a bathroom bill that was saying that you had to put this like really like scary worded sign that said, quote, "This facility maintains a policy of allowing the use of restrooms by either biological sex, regardless of the designation on the restroom," unquote. I think there were some vagaries in that bill too that maybe could have made some ways to work around it. But regardless, Nashville's DA, first of all, said he wanted to enforce it. And then shortly after it was going into effect, it was temporarily blocked. And then in May of 2022, a United States district judge, and I'll say the names since you said you wanted to know the names, Alita A. Trauger, appointed by Clinton, struck down the law permanently. So every now and then, these things end up in front of a sympathetic judge. It's just, and like, I haven't heard anything about this bill going any higher than that court. So, every now and then these things go right, but, as it stands, I'm like afraid to apply it for like additional jobs or afraid to sign a lease because I don't know if the law is going to change in like a month or two where my medication in general is going to be outlawed. So anyway, I just wanted to offer some broader context to all of the bills going on in Tennessee.
Appreciate that. And I'm sorry you're going through all this down there. And hopefully you'll, escape Tennessee or things will change. But it's probably going to be the former before the latter happens. I appreciate it. Hang in there.
Thank you.
All right.
Bye.
All right, folks, that ends the call-in portion of our program. Let's do this last one here. Which one should we do?
Trump.